This episode is about the flexion of the bit with the way the neck's working and the back, and what it came from the old French dressage about the 1800s, and they did, Mr. Boucher, who was one of the French masters, did flexions on the ground before riding. The first point we're going to test at the top of the pole and see if the horse tolerates the pressure here. As we see, I lean on the horse a little bit to the right, so we put some weight on the right hind. This is the main acupressure point for the bladder meridian, which is also back problems, and also biomechanics of the back. So we push pressure, a little pressure, medium pressure, and this horse's head comes down. Some put their head up, some put their head way up. This is a very important point for stomach problems and also stifle problems. It's a stomach point, and the horse gets like that. He will start putting his head up, feel uncomfortable, and you find that. And the other thing, the horse is good in the jaw. After I keep pressure there, sometimes they relax the jaw after I put the pressure, and he makes saliva. This is Vertebrae C2. It's also a point, very important point for neck flexions. And if I can take his head and he stays over on the right foot and not lean on me, and he comes and bends, you can see this horse puts his head down and bends into my pressure and flexion. This is a very important nerve point for all biomechanics of the front. It's C7, and also the stomach point. And if you put pressure there, you want to see if he can put his head down with the bit. At the same time, you can see the muscles transform. And if he's really relaxing the shoulder, I should be able to put my hand behind the shoulder. Now he doesn't move forward or back, but give this horse time, he's never had it done, that he lets me get behind that shoulder blade. This is a master point of the whole horse's body. It's a lung point. It affects the breathing and also the stride and also stress. So if I come in here and see if he can take the pressure, which you see his pressure is not so, this is fairly good. And he flexes with the knee at the same time. As I push him, he puts his head down and he relaxes. That's a very good sign. Now checking the main thoracic vertebrae from T9 to T12. And we check and see if there's any points close to the vertebrae or in the muscles. So we make a little, almost like a snake going down his back, and see if he shows any head raising, pain, pinching, or muscle spasm. Again, that's pretty good. A connection of the withers to the mouth, which is this train through the vertebrae to the bit. And I want to see how many centimeters he can raise these vertebrae up, and that's called dorsal ventral flexion extension. This is the thoracic test. Put his head up. Test again for the second. As you see, he closes, opens that angle, he puts his head down, and that's also a very good sign. This is Josephine, and this is her horse named
Elsie.
Elsie, and she's going to be my assistant because I have to show her how to hold the horse to be safe. Also, it helps me to examine the low back of the horse. First, most important, you always have two hands on the horse, one on the bit, one on the shoulder, or on C7 here. So when she holds the horse, I wanted to put it way here, push the horse a little bit weight on the right foot, at the same time that she just holds the horse so he stays nice and still for me to examine the back. Now we're going to do the withers back to the lumbar and the sacral lumbar joint. Again, a little bit like the snake technique, to the vertebrae, away from the vertebrae, to the vertebrae. As you see, the muscles seem very soft here. And we come to the sacral lumbar joint. The main hind end points we're looking for is L3 and 4, lumbar vertebrae here. It's the nerve that affects the stifles and the hocks. At the same time, we come to the sacral iliac points, up to here. And then the hip point, which is very important also for horses with hind end problems. And if you get to have two hands on the horse relaxes to you because he feels my both hands. At the same time, it's safe because if he wants to kick me, he will push me away. And the next point, acupressure point, is this point here, which is a bladder point. Now into this important point here, which I said was the bladder point, is also a sacral lumbar flexion point to the withers and see if the horse is connected from his butt to his nose. This is flexion number 2. We did the thoracic point, vertical dorsal displacement on the thoracic. Now we're going to talk about the sacral connection to the thoracic to the nose and see what happens with that flexion and the straightness of the spine. I try to keep him straight with even pressure. As you see, he could have a little more connection from this point to this point. There's no muscle pain. It's very good in the front, very good in the hip. He moves good here. You can have maybe 3% better. If I stabilize the lumbar, I come up here and you watch now what happens. You see the difference? In human chiropractics, they call this the brown thumb technique, but it's not really a brown thumb technique. It's just that it's close to the iliosacral ligament. It attaches to the seat bone here. So I come in, and many horses get so stressed in here and painful when they have iliosacral and low back pain. And if you come in here and you push into that ligament, they can be very dangerous and they could kick fast. But this horse shows complete relaxation in this area, all the way through down. And that's why my left hand is here, because if he decides to kick me, he throws me away. And then the other point to find is between the hamstrings down here. Horses with hamstrings, stress, they don't like this being palpated, and very painful in these points. Here's a simple principle they use in all the human sports. They warm up the muscles before competition. They cool down the inflamed areas after competition. So right here, we have a really warm pack, moist cloth here that puts the heat into the withers. At the same time, we have one to the magic point here, which is the breathing and lung point of respiration. So the more we keep this soft, the more we can get the horse flexed and easier time to warm up and less stress to his legs when he's working. And that just puts the moist heat in there. It relaxes the nerves. And when the nerves are relaxed, his mind relaxes. At the same time, he warms up more tuned for you and constructive energy for work. With the moist heat, there's basically a few ways you can get the packs warm. One is basically in a crock pot. You just have that with hot water. And you have to make sure that you can test it, that it doesn't burn yourself before you put it on the horse. If it's really hard on you, it can go on the horse. The other point is that you can use it in a microwave in a bowl of water. Or else what you do is you can get a professional steamer, which some trainers do now, because you can put a lot of gel packs in and treat a lot of horses. The big backpack, usually with the show jumping horses we have, they basically braiding the horse, so we try to make it time efficient, easy for the grooms to do, and also good for the horse. We put about 10 minutes here, then we take the pack off, and we put it 10 minutes on the loin, in here. And then after the 10 minutes on the loin, they just get the horse ready to go, saddle on, boots on, and to the show ring. If you see the horse's head, and you see that if you put a little bit on the pressure, his head comes down. At the same time, I can make the back flexion, and you can see his withers come up more, and you can see that he just more straightened in the back.